Hi, this is Gershon Zinger, and I'll be narrating this slide presentation. It will take approximately 18 minutes, but of course you can pause at any time if you need more time to look at the photos. It starts with a brief test and ends with the answers, so pause if you like and get a piece of paper and a pencil and test yourself. Since I'm not there with you, give yourself a treat if you get them all correct. Here's the first question. How many finger extensor tendons are there, not including the thumb? Question number 2. What is this muscle? Question number 3. What is this muscle and tendon? Question number 4. What is this muscle? Question number 5. What is this muscle? And finally, question number 6, what is this muscle? Hint, this is the dorsal side of the forearm. This famous painting by Rembrandt is the perfect introduction to anatomy of the forearm. There are 2 things about this painting that might disturb you. One is that the forearm in supination shows the flexors, and it appears here that he's holding the flexors in a clamp, but the mistake here is that we know the flexors arise from the medial forearm, and here he is standing on the lateral side. The second problem is that half the people do not seem to be paying attention. At the start of the Renaissance, human dissection was very taboo. Dissections were permitted only once a year after a public execution, and the audience paid to participate. So why aren't they looking? If you follow their gaze, they seem to be looking beyond the body to a book in the corner. Most certainly an anatomy text. The standard text then was 100 years prior by Andreas Vesalius, and you can see here the exquisite anatomic detail. So now it becomes clear, to truly understand anatomy, you need 2 things. It's important to dissect the actual anatomy, but it is also important to refer to the text and the illustrations so that you know what it is you're dissecting. Of course, you could always just tattoo the anatomy on your forearm. In medical school, I learned anatomy initially with this text. And in residency, I learned with this one. You can see that it's been opened and closed quite a few times. I used these 3 sources to prepare this quick tour of the forearm. Hoppenfeld, since this is how residents and we learn anatomy. Acland for longitudinal anatomy, and Meals for cross sections. As far as nomenclature, how we name muscles and tendons, the general rule is to name them by what they do and where they are. Volar medial are flexors. Dorsolateral are extensors. As an example, the tendon that flexes the wrist and is radial would be called the flexor carpi radialis. Now it's important to know that although the forearm has a lot of stuff, most of the muscles move either the wrist, the fingers, or the thumb. There are 3 wrist flexors, 8 finger flexors, and 1 thumb flexor, and there's 2 pronators. On the dorsal radial side, there are 3 wrist extensors, similar to the 3 wrist flexors. There's 6 finger extensors. There's 3 thumb extensors. Actually, one of them is an abductor, showing that thumb extension may be more important than flexion in some ways. And there's 2 supinators to match the 2 pronators. And finally, there's 1 brachyradialis. It's helpful to organize the forearm by the number of layers. This is especially helpful when looking at cross-sections like MRI. The volar compartment has 4 layers, and the dorsal compartment has 2 layers. In both the volar and the dorsal compartments, the wrist flexors and extensors are superficial, and this is worth remembering. We'll begin on the medial or the flexor side. If you put your left hand on your right elbow, the thumb, which goes at an angle, represents the pronator teres, and the other 3 fingers are the wrist flexors, flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. We'll do a lot of abbreviations in this short review, and so I'll call them, for example, FCR, PL, and FCU in the future. Here's a photo from Hoppenfeld showing the medial elbow with the 4 muscles just named. Here's a more realistic dissection view. As I mentioned, the volar side has 4 layers, and here's the first layer with the wrist flexors. Distally, you can see the FDS, the flexor digitorum superficialis, poking out. Removing the 3 wrist flexors, you'll get the second layer, the flexor digitorum superficialis, the FDS. You can see its broad origin from the mid-radius and the proximal ulna. Distally, you can see it covering the third layer, the flexor digitorum profundus and the flexor pollicis longus, the FDP and the FPL. Proximally, you can see the arch of the FDS, under which the median nerve and the ulnar artery pass. Here is the bony origin of the FDS, midshaft radial and proximal ulna. Now removing the FDS, the second layer, we get to the third layer, the FDP and the FPL. They travel together down the forearm. The arteries and the nerves in the forearm are above or superficial to this third layer. You can see the FPL originating just proximal to the pronator. You can imagine that if you plated the radius, the FPL tendon might rub on the ulnar corner of the plate. Here's the bony origin of the FDP on the ulna and part of the interosseous membrane. You will see this on the cross-section. And here is the FPL origin on the radius. Finally, the fourth and deepest layer, the pronator quadratus. We'll go over a few cross-sections and focus here only on the flexor side. We know we are proximal since the radius is round. Looking at the superficial layer, the pronator teres and the wrist flexors. Next is the second layer, the FDS, and then the third layer on top, the FDP attached to the ulna. We are too proximal for the thumb FPL and too proximal for the pronator quadratus. Next is mid-forearm. The radius is teardrop shaped and muscles are turning into tendons. Superficial again are the wrist flexors. Next is the FDS with its radial origin. And deeper is the FDP with its ulnar origin, and the FPL is at the same level as the FDP. You can see by the shape of the radius that we are more distal. The wrist flexors are superficial. Next is FDS with the median nerve deep to it. Then is FDP and FPL at the same level, and the deepest layer, distally here, is the pronator quadratus. Going now to the lateral side, you should learn this order of muscles starting from the lateral humerus, the supracondyle ridge, and going down, specifically, brachioradialis, the ECRL, extensor carpi radialis longus, the ECRB, extensor carpi radialis brevis, EDC, extensor digitorum communis, ECU, the extensor carpi ulnaris, and finally, at the elbow itself, the anconeus muscle. The brachioradialis, seen here, is the first muscle. Next are the ECRL, ECRB, and the radial wrist extensors. Note that the ECRB is slightly deep and found really between the ECRL and the EDC. Distally, the ECRL and the ECRB go along the radius and through the second compartment. With the ECRB and the ECRL removed, we see the EDC, from the mid-epicondyle to the mid-dorsum of the wrist. Note that there are 4 finger extensor tendons, and of the 2 extras, one comes from the EDC, that is the EDQ, the extensor digitorum quinti, or extensor digitorum minimi, and proximally it comes from the ulnar side of the muscle, and distally goes through a separate extensor compartment, the 5th extensor compartment, which overlies the DRUJ. One important detail that is worth pointing out is that the radius is anterior to the ulna. Imagine then that you want to approach the mid-radius or the anterior radius. You have to be fairly proximal or anterior. Since the EDC comes from the mid part of the epicondyle, the interval will be above the EDC, and to get to the bottom of the radial head, it would be best to go below the EDC. I mentioned that the extensor side has 2 layers. The second layer has 1 muscle proximal, the supinator, and 4 muscles distal, 3 that go to the thumb, and one to the index finger. Distally, you can see the first two, the APL, the abductor pollicis longus, and the EPB, the extensor pollicis brevis, go over the wrist extensors and through the first extensor compartment, the one that causes de Quervain's. The third tendon is the thumb EPL, extensor pollicis longus, which goes through the third extensor compartment at the wrist. And the fourth tendon is what I would call unexpected, the EIP, the extensor indicis proprius. What is this muscle doing here? Here is the overview from Hoppenfeld. The dashed line is the dorsal approach to the radius, proximally between the EDC, the finger extensors, and distally between the wrist extensors and the thumb extensor abductor. Here is the first layer again, brachioradialis, ECRL, ECRB, EDC, and the ECU. And here's the second layer with radial nerve dividing into radial sensory and posterior interosseous nerves, the supinator proximally and the four muscles distally, 3 to the thumb and 1 to the index. And here's a proximal cross-section. The radius is round, and focusing now only on the extensor side. The first layer is brachioradialis, then ECRL, ECRB, EDC, and ECU. The deep layer is the supinator. Mid-forearm with the teardrop-shaped radius, brachioradialis, radial wrist extensors, EDC and EDQ, and the deep layer with the abductor pollicis longus, the EPB, and the EPL. You can see by the shape of the radius that we are now more distal. There are 2 pronators and 2 supinators in the forearm. One pronator at the elbow is the pronator teres, and at the wrist is the pronator quadratus. The pronator teres has 2 origins, one above the elbow at the medial epicondyle, and one below the elbow at the proximal ulna. At the wrist, the pronator quadratus has its origin on the ulna and inserts onto the radius. It is this muscle that must be elevated when plating the radius on the volar side. The 2 supinators include the biceps, which of course originates above the elbow and in the forearm, and inserts onto the radial tuberosity of the proximal radius. Here you can see in a lateral view of the proximal radius 3 muscles in a row. First the biceps tendon, then the supinator, and third, coming from the opposite side, is the pronator teres. We will briefly look at the arteries. The brachial artery is palpable in the arm above the elbow and divides at the elbow into radial and ulnar arteries. You can see it splits under the bicipital aponeurosis. The radial artery is under the brachioradialis as it travels distally down the forearm. And the radial artery is palpable distally between the tendons of the brachioradialis and the FCR, and this is where we typically measure the pulse. Distally, there is a branch of the artery over the FCR tendon. During the anterior approach to the radius through the FCR sheath, it is best to preserve this arterial branch. The brachial artery at the elbow splits into radial and ulnar just distal to the bicipital aponeurosis, and the ulnar artery then dives deeper, going under the pronator teres and the FDS muscle origins. The ulnar artery sends off the common interosseous branch that provides much of the arterial flow to the dorsal forearm. The ulnar artery then travels distally on top of the FDP and under the FCU and joins the ulnar nerve about mid-forearm. We will briefly cover the 3 nerves of the forearm. The radial nerve is found at the elbow between the brachialis and the brachioradialis. It then splits into motor and sensory branches. The motor is now called the PIN, the posterior interosseous nerve, and the sensory is now called the SRN, the sensory radial nerve, sometimes the RSN, radial sensory nerve. The SRN travels under the brachioradialis and exits distally to supply sensation over the dorsal radial hand. Let's look at the median nerve. The median nerve, which is just radial to the brachial artery, goes from superficial to deep. It goes under the pronate and between the 2 origins of the pronator teres and under the arch of the FDS. It then travels down the forearm, superficial to the FDP and under the FDS, that is between the 2nd and 3rd layers. And just before it reaches the wrist, it switches position and becomes superficial to the FDS tendons. It is in this superficial position in the carpal tunnel and note that in a wrist laceration, it is in danger when the laceration is distal at the wrist. Finally, the ulnar nerve. The ulnar nerve enters the forearm behind or dorsal to the medial epicondyle, otherwise known as the funny bone. It apparently is funny to others when someone hits this superficial nerve. The nerve enters the FCU, the flexor carpi ulnaris. It enters through the muscle proximally and travels under the muscle of the FCU and above the FDP until it reaches the wrist. Here you can see a sensory branch exiting, which then provides sensation to the dorsal ulnar hand. Let's briefly review. The volar side has 4 layers. The first includes the pronator teres, FCR, PL, and FCU, the wrist flexors. The second layer is the FDS, the flexor digitorum superficialis. The third layer is the FDP and the FPL. And the fourth layer distally is the pronator quadratus. On the lateral side, there are 2 layers. The first layer includes brachioradialis, ECRL, ECRB, EDC, and anconeus. And the second layer includes proximally the supinator and distally the 3 muscles to the thumb, abductor pollicis longus, EPB and EPL, and finally the index extensor tendon, the extensor indicis proprius. To summarize, there's a lot of stuff in the forearm. Most of the muscles move the wrist, the fingers, and the thumb. Remember, there are 4 layers on the volar side and 2 on the dorsal side, and the wrist flexors and the wrist extensors are superficial. Now back to the test. Let's see if you can answer the questions now to see how much you've learned. The first slide will be the question, and the following that will be the answer. How many finger extensor tendons are there? 6, 1 to each finger, and 2 extra, 1 to the index and 1 to the small. What is this muscle? This is the FDS. This is the second layer on the volar side. You can see the broad origin from the mid-radius and the proximal ulna. And question number 3, what is this muscle tendon? This is the flexor pollicis longus in the third layer on the volar forearm. Question number 4, what is this muscle? This is the third layer, the FDP, the flexor digitorum profundus, and it attaches to the ulna. Question number 5, what is this muscle? On the dorsal side of the forearm, it attaches to the ulna, and it is the muscle, and its muscle almost to the wrist, the extensor carpi ulnaris. Final question, what is this muscle? This is on the dorsal side of the wrist, the second layer, and is the extensor indicis proprius to the index finger. Hopefully you can tell from going through the questions after the talk that you've picked up a few details of forearm anatomy. And now you all know what the inside of the forearm looks like. Thanks for watching this short PowerPoint presentation on forearm anatomy. Hope you enjoyed it.